Hey everybody, a little different today. Obviously, can't see my beautiful face, but that's okay. You'll get to see it again tomorrow. So, I just wanted to talk about kind of following up on what we did yesterday. So, I'm going to send this to the Health and Human Services, the head of the Human Services for the city and county that I work in, and we're going to see if I get anything back. So I'm going to send this gentleman an email. It's going to say, "Hi, my name is Nathaniel Ryan. I'm a teacher within your city and county. I put this little video together to help me ask you some general questions about COVID-19 cases. I will list my questions at the bottom of this email for quick and easy access to them. If the context of any of my questions does not make any sense, you should be able to get the context from the video. I have also added the presentation itself so you can have quick and easy access to the original sources I used in the presentation. Thank you for your time and consideration. I look forward to hearing back from you." And then I listed my questions and then sincerely my name, right? So I'm going to do a little practice here, a little pretend and act like I'm presenting my presentation to this gentleman. Hello and thank you. I just had some questions for you. So today I was on your Health and Human Services website, and I see what is highlighted here in yellow. It says, "To stop the spread of COVID, the city and county buildings are open for limited in-person appointments only starting on Monday, November 23rd. Please visit Health and Human Services page to find many online services, programs, and virtual opportunities to connect with staff and support residents during these tough times." So I'm assuming the reason that is there is because there's lots of cases, right? To stop the spread of COVID. If COVID is spreading, then that means there are lots of COVID cases out there. So that's what I wanted to talk about. I wanted to ask what that meant, right? So again, if we're following that assumption of cases, then what is a definition of a case? So this is pulled, as you can see at the bottom in my link that I've attached. The CDC's definition of a confirmed case is it means that it meets laboratory evidence, right? So what does that mean? I know that you know all this stuff. I'm just kind of showing you that I know what I'm talking about, maybe, hopefully, in some way, shape, or form. Obviously, if I'm wrong in anything that I say, please correct me because I am desperately looking for correction. So I'm assuming this means that you're going to a lab, a doctor's office, you're getting the swab stuck up your nose, and then what's happening after that is it's going to be put into a test tube, and they're going to be amplifying and pulling out some RNA to test for, as it says there, SARS-CoV-2 specific primers, right? But then it says for number 4, it's going to interpret the results to detect the presence of viral RNA that indicates an active SARS-CoV-2 infection, right? Same way with the saliva test, right? So, but what does it mean to amplify by PCR? I'm sure you know the answer to this. I had to use this video in order to understand what it meant. But so the video's there, obviously more for me than for you, but this is where I got it from, Promega. If Promega makes a lot of different testing products, so I figured they would know what they're talking about. If they're not a good source, please let me know. But basically, what I'm understanding is that the PCR is a method to amplify the DNA so that they can produce specific fragments. Obviously, those fragments would be fragments of the COVID-19 disease, right? Each PCR cycle doubles the amount of target sequence. The number of cycles increases. Theoretically, the number of DNA molecules increases exponentially, so that after 30 cycles, more than 1 billion copies have been generated. This repeats about 20 to 40 cycles. So kind of review. Basically, they're swabbing some of the DNA out of your nose, putting it into a test tube. They target the DNA they want to amplify, the DNA that is going to show SARS-CoV-2 positivity or negativity, hopefully in theory. They amplify this DNA somewhere between 20 and 40 times so they can see it presumptively. Lab technicians look at the amplified sample and determine the presence or lack thereof of viral RNA or DNA, which would indicate or not indicate active SARS-CoV-2 infection. And they do this to determine the presence of viral RNA. You are now officially a case because you are now a person with laboratory confirmation of COVID-2, SARS-CoV-19 infection. Please tell me if I am incorrect in any of this summary. So this is when I put a video for myself about exponential growth, just to help me understand how that works. And then I also said the number of cycles equals the number of amplifications exponentially, right? So that's got to be huge. So then I put my math down, right, of course. And so just kind of seeing the difference between 20 cycles and 40 cycles is monstrous, right? 1 million to 1 trillion, essentially, right? So since the number of copies grows exponentially with the number of cycles being counted, what the number of cycles in each lab that each lab is using for be extremely important, since the difference is monstrously massive, right? So why am I making a big deal out of this, Witten? You want the number of cycles as high as possible so you can know how for sure whether you have COVID-19 or not, right? That's what I thought. So then I saw this. I saw the Croman Drosten review. I don't know if they are legitimate or not. I'm hoping they are, of course, because I want as many good sources as I can get. So please let me know. They did an external peer review of PCR tests to detect SARS-CoV-2, and they wrote a paper talking about the 10 major flaws of the molecular and methodological level of consequences for false positive results. So obviously out of that list of 10, number 3, the main thing they talked about was the number of amplification cycles, less than 35, but preferably between 25 and 30. So the main finding that was in number 3 was that if someone is tested by PCR as positive, then a threshold of 35 cycles or higher is used, as is the case in most laboratories in Europe and the US. The probability that said person is actively infected is less than 3%. The probability that said result is a false positive is 97%. So if false positive is 97%, and as they say here, we're using thresholds of 35 and higher in the US, then that raises a lot of questions for me. So here's my question, but you'll get this again later on, so I'm not going to belabor it. So obviously judges in Portugal took this seriously, because judges in Portugal say that there's more than debatable reliability of the PCR COVID test. So they cited the study that I just talked about and made such a big deal about it that they said that we shouldn't be doing this. Next thing I want to hit up is a New York Times article, which talks about a lot of things that really, I don't know, at least brings caution to me in regards to all this. So obviously the headline is, your coronavirus test is possible. Maybe it shouldn't be. The usual diagnostic tests may simply be too sensitive and too slow to contain the spread of the virus. Obviously this isn't an academic journal or anything. This is a newspaper article that you've probably read. So I don't want to belabor it too much, but there's a lot of good professionals in here. We have Dr. Mina from the epidemiologist from Harvard. So bringing up a lot of different things. So first thing they say is that most people are not likely to be contagious. The next thing that shocked me was that it's the amount of virus that should dictate the infected person's next step. It's really irresponsible, I think, to forego the recognition that this is a quantitative issue. The greater the viral load, the more likely the patient is to be contagious. The cycle threshold is never included in the results sent to doctors and coronavirus patients, although it could tell them how infectious the patients are. So that brought up a question, of course. In 3 sets of testing data that include cycle thresholds compiled by officials in Massachusetts, New York, and Nevada, up to 90% of people testing positive carried barely any virus, a review by the Times found. So my question is, what happens if we apply that to where we live and work? So most tests are set the limit at 40, which we talked about before. I would love to know if you know if that's the case or not here. Tests with thresholds so high may detect not just live virus, but also genetic fragments, leftovers from an infection that pose no particular risk, akin to finding a hair in a room long after a person has left. Any test with a cycle threshold above 35 is too sensitive. A virologist from University of California, Riverside, is shocked that people would think that a 40 would represent a positive. That's mind-blowing, at least in my opinion. A more reasonable cutoff would be 30 to 35, she added. Dr. Mina said he would set the figure at 30 or less. Those changes would mean the amount of genetic material in a patient sample would be, and we've talked about exponential growth. The CDC's own calculations suggest that it is extremely difficult to detect any live virus in a sample above a threshold of 33 cycles. And that blue in there, you can click and see, because it goes right to what the CDC said. So aren't we trying to detect live virus? And if anything is over 33, then what are we doing? We're not detecting live virus if we're using CT cycle thresholds that are above 33 in any of our tests. That's why we need to know the cycle threshold of all of our tests, period. I hope you agree with that assessment. It is just kind of mind-blowing to me that people are not recording the CT values from all the tests, that they're just returning a positive or a negative. In July, a lab identified 872 positive tests based on a threshold of 40 cycles. With a cutoff of 35, about 43% of those tests would no longer qualify as positive. About 63% would no longer be judged positive. The cycles are limited to 30. So I would love to know what our numbers, if we're using a PCR test set at 40, I would love to know what the numbers would look like if they were set at 35. I would love to know what the numbers look like if they were set at 30. If you could do that for me, that would be great. In Massachusetts, from 85 to 90% of people who tested positive in July with cycle threshold of 40 would be deemed negative if the threshold were 30 cycles. I would say none of these people should be contact traced, not one. So that obviously goes into the contact tracing issue. So Dr. Mina says that anybody that's testing positive with cycle thresholds of 40 should not be contact traced. I would love to know what you think about that statement. So the FDA noted that people may have a low viral load when they are newly infected. A test with less sensitivity would mean miss these infections. But the problem is easily solved. Test them again, right? We saw that with Nick Saban at the University of Alabama, if you're familiar with that case. But with 20% or more of people testing positive for the virus in some parts of the country, Dr. Mina and other researchers are questioning the use of PCR tests as a frontline diagnostic tool. After reading this article, I seriously question the use of PCR tests as a frontline diagnostic tool, especially those with a cycle threshold of being 40, which has been reported multiple places so far. That number is so key to everything. So the questions are laid out here to kind of make it plain as day, hopefully. FDA case definition for testing vaccines. So this kind of brought up some questions because we have PCR tests count as cases, at least I'm guessing, I could be wrong, please let me know if I am wrong, in your city and county. But when we're talking about testing for vaccines, the FDA definition is different for Moderna and for Pfizer. So I would love to know why they have two different definitions, why the CDC's definition of a case is not the definition Moderna and Pfizer was when they were made to use by the FDA to define COVID-19 cases in their vaccine trials. that would be wonderful to know if you have any idea on that. So the Oxford University Center of Evidence-Based Medicine, they did a systematic review published earlier this month, and they confirmed that COVID-19 PCR testing patient sample threshold counts of more than 30 are associated with negative viral cultures, i.e., are non-infectious. So part of the results said that 2 studies reported the odds of live virus culture reduced by approximately 30% for every one of the unit increase in cycle thresholds. And one of the conclusions they made was that complete live viruses are necessary for transmission, not the fragments identified by PCR. So once again, we're seeing this again. We're seeing that the higher you get, the less live virus you're actually finding, and that we're finding fragments, not necessarily live virus with anything above 30. So if we're using tests above 30, why? I'd love to know why. So more questions based on that. So the Florida Department of Health on December 3rd, same date as the Oxford study, they made it mandatory that lab test results report cycle threshold values. So obviously this isn't an unprecedented action. I would love to know if you think that this was a good action or not, and if you think that maybe our state and our county and our city may want to do the same thing or not. That would be great to know. So I took a screenshot of our total cases according to Google. And so based on everything that I just talked about, do you believe that these counts are accurate? If so, it makes you believe that they are accurate. If not, I was wondering what we could do to possibly hopefully get an extra count. So as I said, I'm a teacher, so I'm very concerned of that we're basing policy on these tests because these tests bring us the cases, and the cases bring us the actions that say kids shouldn't be in schools because cases are rising. I can show you emails from our district that state that's the reason kids aren't going to school. If you really want to see them, I'm sure you already know that's the case because I'm sure that you're already in contact with our district about all of these things. So here's what the Journal of American Medical Association, I can never say that right, JAMA, came up with. They did an estimation of the U.S. children's educational attainment and years of life lost associated with primary school closures during the coronavirus disease 2019 pandemic, and they found that the decision analytical model found that missed instruction during 2020 could be associated with an estimated of 5.53 million years of life lost. This loss in life expectancy was likely to be greater than would have been observed if leaving primary schools open had led to an expansion of the first wave of the pandemic. That is a devastating conclusion, in my humble opinion. Then I looked at what the United States Children's Fund, UNICEF, said. They said that schools are not the main drivers of COVID among kids. They said that data from 191 countries shows no consistent link between reopening schools and increased case of coronavirus infection. They also said that there's strong evidence that with basic safety measures in place, the net benefits of keeping schools open outweigh the costs of closing them, and that schools are not a main driver of community transmission, and children are more likely to get the virus outside of the school setting. Wow. So, more questions. I also you probably know all about this too, of course, but NPR did a story about a new dashboard that tracks coronavirus cases in schools across 47 states. So here's what it looks like. So basically, obviously this was just, the JAMA study was just a guesstimation or an educated guesstimation, I guess you could say, to give them more credit. And then we have UNICEF saying all the things that they said, but then we have this data this data that's the most updated data that this dashboard has. I don't know who puts this dashboard together. You may know, you may look at this every day. I don't know. But just these numbers here, the number of cases as compared to the number of students who are in school is beyond minuscule. So just kind of wondering what's going on, because we have 5.53 million years of life lost for this. You know, I'm trying to understand, and I would love to know what answers you might possibly have for me for all my list of questions. And all I want to tell you more than anything else is thank you. You've been put in an impossible position, of course, because you can't win either way. And I just want to thank you for your service to the community and for everyone that you serve. And as always, of course, I look forward to your answers to my questions. Thank you for your time. Have a great day.